Welcome to The Other Side, Mississippi Today's political podcast. I'm your host, Adam Ganeshow. The Other Side lets you hear directly from the most connected players and observers across the spectrum of politics in Mississippi. From breaking news to political strategy to interviews with candidates and elected officials, we'll bring you facts, perspectives, and context that helps you cut through the noise and understand all sides of the story.
I'm Jeff Pender, joined here today with my colleague Bobby Harrison.
Hey Jeff, how you doing, man?
Hey Bobby. And today's guest, I believe she's been on our show before. She is Angie Calhoun. She's the founder and CEO of the Mississippi Cannabis Patients Alliance. Ms. Calhoun, welcome. Thank you for coming on the show.
Well, thank you so much, Jeff. I appreciate y'all inviting me to be on your show. And, this is just an honor and privilege.
Well, Ms. Calhoun has, she helped champion the passage or legalization of medical cannabis in Mississippi, and comes at this from I guess you'd say, a personal situation as a mother. Am I correct?
Yes, that's exactly right, Jeff. My son, who is almost 30 years old now, but when he was 17, he was bitten by a tick and got Lyme disease, but we did not catch it in time. Over about a year and a half's time, he was taking about 17 pharmaceutical drugs to take multiple times a day, every day. We had seen over 22 doctors, and he really wasn't getting better. And so as a family, we prayed about it, and we decided to take him to Colorado to try medical cannabis because he had severe nausea, vomiting, and a seizure disorder. And so it was just amazing how quickly it made a change in his quality of life. It's not a cure. He still does battle with issues, but it helped him so much to be able to to get married. And now he has a 9-month-old son, my sweet grandbaby. And so, there was a time when I didn't know if he would even live or even have this sort of future. So really thankful.
Yeah, Miss Angie, Jeff and I are getting so old. You're not, but I remember we talked to you when this was all in the process of going through the legislature. We did a podcast with you, and am I wrong? But at the time, he was pretty much having to live out of state.
Yes.
So he's able to move back to Mississippi now and live, and your grandchild's close to you.
Yes, and I'm so grateful for that. And Bobby, yes, that was the other part of our story, is that Austin decided that it would be best for him and, of course, us as a family if he were to live out there. Of course, I stayed with him until he really was able to function on his own. And but he lived out there for several years, and then Initiative 65 came about, and then, of course, we realized, the Supreme Court had overturned it, which was one of the most devastating days of my life. And then, the legislators, Kevin Blackwell and Lee Yancey, worked diligently to pass a medical cannabis program for the patients, which helped to bring my son back home. And that is something I'm so very, very grateful for, because Austin and I are very close, and I like having him close by, and it's just been wonderful having my grandson close by.
Well, given that background, what brought you into this issue, this is something we've talked about on this podcast a lot, and we have talked a lot about the politics, the legislation, even the business aspect, the taxes as it pertains to medical cannabis. But I don't know. In my mind, sometimes the patients don't get as much focus. So, for lack of a better way to put it, where do things stand right now from a patient standpoint? Are things going pretty well, or people who need this treatment able to get it?
Yeah. Well, we actually have 46,600 patients with active cards. So that is a pretty big for such a short period of time. And so that's really exciting. And it's so wonderful to hear from patients who tell me how much better they feel and that their quality of life has, just increased tremendously. And that's just what we all wanted, to make sure that patients could have an alternative medicine that would help them and to, hopefully reduce their pharmaceutical drug use. And so that's very, very exciting. We really have had closer to 60,000 people overall to get a card, but we have about 13,000 that have expired. And so we are investigating and going to be doing a study, to see kind of, what the reasoning is on that. And, I have a feeling that it is a price barrier. But overall, a lot of the practitioner visits are still pretty expensive, although we do have a number of clinics who are being very reasonable. But, then the products are pretty costly. And, we live in one of the lowest income states in the country. And so therefore, our people are not able to pay the premium prices that a lot of the dispensaries and cultivators are charging.
And no insurance, obviously, is going to help with that.
And so there is a way for the initial visit to be covered by insurance because, that's just like a consultation. So a lot of the practitioners, may or may not realize that, but yet a lot of these practitioner clinics have set up to solely certify patients for medical cannabis because they don't want to fool with insurance, and which we all know can be very costly on their end and just kind of a headache. So it's something that we hopefully will get addressed, and I think the prices will continue to lower. We want everybody to succeed, but most of all, we all need to realize we want patients to succeed in gaining quality of life and feeling better.
Are there enough providers, practitioners? If somebody feels they need to go and at least have this considered as a treatment of medical marijuana, is it hard to get in to see a practitioner?
It really is not. We have about 260 active practitioners across the state. And, some of the highest concentrations are in like Rankin County, Harrison County, and DeSoto County.
Which are the biggest, that makes sense.
Yeah. And so, of course, in Harrison County, we have a lot of veterans down there. And so and I get a lot of calls from veterans in that area in particular. So, that actually has the highest concentration overall of about 8,300 patients there. And so, we do have ample practitioners at this point in time. And most patients get in within a week, if not even sooner in most cases.
When we're talking about this treatment, I know you keep up with some of the research and all. I don't know. I said one time back when the political debate was going on and passage of the bill and everything that you had one side claiming that it had no medical value for treating anything at all. You had the other side claiming it would treat everything from athlete's foot to xenophobia. So I'm sure it's somewhere in the middle. What kind of conditions are we talking about here? Many, if not most of these patients, it's the word chronic applies, correct?
It generally is, yes. And the patients are required initially to bring in their medical records from their existing provider so that the practitioners can look at that to verify that they have an existing condition. Now, some of the conditions are, MS, you've got neuropathy, autism, HIV, ALS. There's whole list. And my website at mscannapatient.com has the entire list there. But, pain and chronic nausea and vomiting are two of the biggest conditions that people get certified for, and PTSD is also one. But I've also seen a lot of moms contacting me about their children with autism, and it really helps to lower the sensory, that over-aggressive sensory that they have going on, and to where they're more relaxed and calm. And so that's really, really rewarding to hear that, we do have children and children with seizure disorders benefiting as well.
So you have to go to just to kind of go through the process. You have to be seeing another doctor before going to the medical marijuana practitioner. Is that how it would work?
Yeah, because the law and rules and regulations, stipulate that you have to have like a chronic or pre-existing medical condition. However, there are a few clinics, depending on the actual physician or the scope of practice that the nurse practitioner and physician are in, that they can actually diagnose, say, someone with PTSD or with chronic pain syndrome. But that goes into, the Mississippi Department of Health looks back into, the scope of practice of where they are board certified and this and that. And so there are a few that actually can do that. It's kind of, a little bit of a tricky situation, but it works out. And we try to find who has that specialty, because sometimes that's who we need for special cases.
Well, I may be wrong, but I assume that it's just kind of just programmateurs. You have more of that, or you have the doctors who are treating the ailment they would have the authority, and they could at least gain the authority to prescribe medical marijuana, just like they prescribed some other drug. I'm sorry, am I making sense when I?
Yeah, I think you're saying that any provider is, so he has a private clinic. We don't see a lot of the bigger clinics or hospitals joining in on this so much. However, UMMC actually does have some certifiers there, but they are pretty strict about their guidelines and all. But we're thankful, just so thankful to hear that they are opening the door to that. And but yeah, a practitioner in just a regular type clinical setting could certify patients there, as long as, and generally what I see is that they are the sole owners of that clinic, because we still are having trouble getting through with, like, say, potentially the Baptist or Merit Health and places like that. But, we're taking it one step at a time, and we're, brick by brick, we're going to build this up and make it a wonderful program. And I'd love to say that we really are hoping to open the hearts and minds of many of our pain management doctors and nurse practitioners, because they are typically not favorable of using medical cannabis with their opioid, or and it's been a real big problem that call me frantic. They don't know what to do, and because they've not gone through a proper taper protocol, the practitioner is angry that they're using medical cannabis, because they have to take a urine screen test to make sure that they are taking their opioids, but also if they're using other potential drugs. So they're like, "You're coming off," or basically firing you from this program, and good riddance. And that is just extremely dangerous for somebody that's been on a high dose of opioids for years, potentially, because what happens is they will go through with withdrawal, but say they are having severe pain and they're like, "Oh, well, I'm just going to go back and take my regular dose. I had a few left over." Well, that is where the problem comes into play, and that's how people overdose and die on opioids, because their body is not used to that same dosage that they have been on. And so that is a big area that I'm trying to help with. And just going back to the University Medical Center, their CEO department, Vicki Skinner and her team, they had asked me to be on their planning committee. On February 8th, there will be a CME PE day there at the student union at the hospital. So we're really excited about that and how to educate our practitioners more and helping to end the stigma.
One thing I was wondering, I think before we got started here, you reminded me we're looking at, it was April 2022 when the program officially opened, I guess. How satisfied are you at this point with the law and the way things are being regulated? Does the law still need work or a do-over, or you think it's a pretty good framework? Or
Jeff, I think the official legislative term is tweaking.
Yeah.
Well, it really is a wonderful program. Kevin Blackwell and Lee Yancey really did a stellar job on trying to address the needs of the patients while also, making sure that the industry succeeds. And I think industry-wise, the biggest issue now is that it is oversaturated across the state. And so, unfortunately, there are some companies that are not able to stay in business. And I do feel for them, but it is Business 101. Not every business will succeed, unfortunately. And but for the patients, it really almost any medical condition is covered that is chronic and that is very painful for patients. We do hope to have a research study launched that will examine anxiety and insomnia as a new addition to the medical conditions. Potentially, and that goes through the Mississippi Department of Health, who has designated the University of Mississippi's National Center for Cannabis Research and Education to investigate and learn about that and to see if it really is something that we need to add to our debilitating medical conditions for our state.
When this was being debated, folks and there were folks who fought against this strongly. Some folks in law enforcement, they had some fears that this was going to add to the black market. It was really going to end up being just a recreational program, things like that. Unless I've missed something, has any of that come to pass? I mean, have we seen any major problems that you're aware of?
I'm quite sure, and I am aware of a few minor situations. Well, let me correct that. They're not minor; they are big, but they're far and few between. I've actually spoken with the Sheriff's Association at their conference and the Police Chiefs Association's conference about medical cannabis, and they have an easy way to scan not to scan, but to put in place a website with the Mississippi Department of Health, and then they can enter that patient ID number. And so they know if that patient really, should have cannabis with them or not.
Yeah.
And it's a very easy little process to check the cards. And so, but overall, I'm there. I'm really, really amazed that the law enforcement, they're actually pretty happy, and they're like, we've read through this long bill, and we really find that they have done a great job at, protecting the patients, but not making it hard on law enforcement. Excuse me. And so, I'm really amazed that they have been very open-minded, and they do see the medicinal side of it. But of course, they don't want anybody driving impaired. And, that's something that we teach and try to promote is never to drive impaired. That's not safe. Not ever.
Going back to, you talked about oversaturation a while ago. Were you referring specifically to the growers when you talked about oversaturation, or?
Oh, the oversaturation I'm talking about are the business entities like dispensaries.
Okay.
Cultivation especially, and the processors, but a lot of cultivation centers are out there, like 122 if I'm not mistaken, and so that's a lot of cannabis being grown throughout our state, and there's really just too much for the number of patients that we do have right now. And so time will tell as to how that's going to work out for them. And so we do wish everybody the best. And but it's just going to take time for the whole program to grow to meet the supply chain that's being produced.
Yeah, it seemed like maybe getting too far in the weeds, but you mentioned the price points a while ago were kind of high. It seemed like with all that oversaturation, that would drive down the price. But I guess there's just regulations that are put in place that forces those prices to be what they are, maybe.
Yeah. There's nothing that regulates the prices. They can sell it for what they want. Of course, the cost of production comes into play. And so, I think it's just a new industry. And of course, people have to recoup their money, and they do have to charge a little bit more in the beginning. But in other states, typically you see a decline in price over the years. And so, just always ask that our cultivators, processors, and these dispensaries do realize that we are a poor state. People can't afford the high prices, and they shouldn't be denied because of a cost barrier the right to be able to have quality of life through medical cannabis potentially.
You mentioned law enforcement. We talked about the legislation. I know early on the health department, perhaps reluctantly, was given the task of regulating this. They had a couple of hiccups early on, I think we all saw. But how are they doing now? The regulatory side seem to be operating well?
I'm in pretty close contact with Dr. Edney and Laura Goodson, who is the director of the Medical Cannabis Program. And really, I am just so pleased with the work that they're doing. They do care. They do believe in the medicinal benefits of it. Especially this year, it's been really wonderful because, as you know, I helped to pass the Mississippi Medical Cannabis Research Program, which gave $1.5 million to the National Center for Cannabis Research and Education at Ole Miss, which that's a 55-year-old study, grow there. And so they've been studying that for a long time, obviously. And so we wanted to make sure that our state program was funded and able to do more work. The Department of Health is really leaning on them for help and guidance in a lot of their decisions. Rules and regulations, and there are hiccups with the industry. Like recently, a deal has been that we want a little bit stringent mold testing guidelines. And, mold is not good for anybody, and we sure want any type of mold in patient products because it is something that can cause a lot of health problems for many, many people where it's tested or just breathing. So, those are things that the university is helping with because, Dr. Osoli's lab and they're all, very much educated in how to do this because they've been working under the MITRE program for so long.
One thing I wanted to ask you, and this might be a relatively good way to close, your alliance, the Mississippi Cannabis Patients Alliance, you provide resources to patients. Maybe you could outline some of those, some of the things you offer help and guidance for patients.
Yeah. Well, our goal is to educate, navigate, and advocate for patients and for practitioners. And so we're very, very robust website, and that's mscannapatient.com. And therefore, just about anything that a patient could ever want to ask, that information is on our website. We also have a flipping book that with others that's got a plethora of information there in it. We also do a newsletter at once or twice a month, just depending on kind of what's going on. And that it generally has updated information from the Department of Health or through and things like that, or just to educate people. One of our biggest issues honestly, Jeff and Bobby, is that a lot of our cannabis products are very strong. And I've had a lot of patients tell me that they were just, it got them so high that they could not function. And they either get severe anxiety, paranoia, schizophrenic episode, or they just can't even get off of the sofa, which, that most people call that couch lock. But that's a cool way to be. And I've had several say, it took us literally a week to get over that one time, because we want our patients to understand that titration, and that is finding the lowest possible amount of medical cannabis to treat your debilitating condition without being impaired.
Yeah.
So, the impairment side leans a lot more toward the recreational market, but the medicinal side is, to find a way that you can function, you can drive your kids to school, you can go to work. And that's what we really, really want. We want to see people return back to being able to work and to enjoy being out and about in their families. And where, prior to having medical cannabis or, any other medicine, they're not able to function. So, our website is just full of that information. Yesterday, I was down at the Mississippi Nurses Association's conference. I was there helping to educate our nurse practitioners and give them some information on the entire program, the laws, like that. So that's just really an honor and privilege for me to be able to help not only the patients but our practitioners. And our website, interactive map. So if patients need to find a practitioner who is a certifier in Mississippi, they can go to our website. It has that interactive map there, and they find someone there, and they have a dispensary finder each, which also has any of our dispensaries listed there.
Okay, and that's Canna Patients.
MS, like Mississippi Cannabis Patients Alliance, MSCANNAPATIEN.
Okay. And we will be sure and put that in the information for this podcast. Well, look, we really appreciate the update. Appreciate you coming on again, and maybe tentatively say we'll check in again. It's good to hear. Good to hear from a patient, more of a patient's perspective rather than, totally politics and taxes and regulations. Yeah. But it sounds like things are working fairly well, and you're working to keep improving them.
Yeah, the sky's not falling as some people predicted would happen.
And the world is still turning. The sky did not fall. Patients are getting relief all across the state. And that is just, surreal and wonderful news to hear that from our patients. Like I said, I was down in Biloxi for the nurses conference, but I had an Uber driver, and, we were chatting in the car, and he wanted to know what I did. And I told him, and he said, well, I just want you to know I'm a medical cannabis card holder, and I just feel so much better. And, he just couldn't thank me enough for what had come about. And so that was just wonderful to be able to be out and about and people tell you their stories and to listen and hear from them. And very rewarding.
And he was functioning just fine.
Yeah. He's my Uber driver, and I couldn't obviously.
Well, thank you again for joining us, and we look forward to talking with you in the future and getting further updates on this program.
Yeah, enjoy that grandbaby.
I sure would like to get a lot of sugar from him.
Thank you again.
Thank you.
Have a wonderful day.
As we cover the biggest political stories in the state, you don't want to miss an episode of The Other Side. We'll bring you more reporting from every corner of the state, sharing the voices of Mississippians and how they are impacted by the news. So what do we need from you, the listener? We need your feedback and support. Subscribe to our weekly podcast on your favorite podcast app or stream episodes online at MississippiToday.org/The Other Side. For the Mississippi Today team, I'm Adam Ganeshow. The Other Side is produced by Mississippi Today and engineered by Blue Sky Studios. We hope you'll join us for our next episode.